Welcome to our comprehensive guide on assessing the gastrointestinal (GI) system. In this step-by-step approach, we will take you on a journey through the intricate world of the GI system, equipping you with the knowledge and skills to evaluate its health and functioning. Join us as we explore the anatomy, techniques, and assessments essential for a thorough GI assessment. Chapter 1. Anatomy and Physiology of the Gastrointestinal System. Begin your journey by understanding the anatomy and physiology of the GI system. Explore the structure and function of organs such as the esophagus, stomach, small intestine, large intestine, liver, gallbladder, and pancreas. Gain a solid foundation of knowledge to guide your assessment. Chapter 2. Preparation and Patient History. Learn how to prepare yourself and the patient for a comprehensive GI assessment. Discover the importance of gathering a detailed patient history, including symptoms, dietary habits, medications, and past medical history. Effective communication and a patient-centered approach are crucial in obtaining accurate information. Chapter 3. Inspection and Observation. Master the art of inspection and observation during a GI assessment. Explore visual cues such as body habitus, skin color, and signs of malnutrition or jaundice. Observe the abdomen for any visible abnormalities, such as scars, distension, or masses. Chapter 4. Auscultation. Delve into the world of auscultation, a key component of a GI assessment. Learn how to use a stethoscope to listen for bowel sounds in all four quadrants of the abdomen. Understand the significance of normal bowel sounds, hyperactive or hypoactive sounds, and the absence of sounds. Chapter 5. Palpation. Develop your palpation skills as you explore the abdomen during a GI assessment. Discover different palpation techniques, including light palpation to assess superficial structures and deep palpation to detect organ enlargement or masses. Understand the importance of gentle and systematic palpation for patient comfort and accurate findings. Chapter 6. Percussion. Uncover the technique of percussion to assess the GI system. Learn how to elicit different sounds by tapping on the abdomen, including tympany, dullness, and resonance. Interpret these sounds to evaluate organ size, fluid accumulation, or possible masses. Chapter 7. Examination of specific organs. In this chapter, we focus on specific organs of the GI system. Explore techniques for assessing the liver, gallbladder, spleen, and kidneys. Learn palpation and percussion techniques to identify organ size, tenderness, or abnormalities. Chapter 8. Examination of the rectum and anus. Discover the essential steps for assessing the rectum and anus. Understand the proper technique for performing a digital rectal examination, DRE, including assessing the sphincter tone and palpating the rectal walls for abnormalities. Chapter 9. Diagnostic tests and procedures. Dive into the world of diagnostic tests and procedures commonly used in GI assessments. Learn about imaging studies like abdominal X-rays, ultrasound, and computed tomography, CORT scans. Understand the role of endoscopic procedures such as colonoscopy, upper gastrointestinal endoscopy, and sigmoidoscopy. Chapter 10. Documentation and Communication. Understand the importance of accurate documentation during a GI assessment. Learn how to record findings, observations, and relevant patient history. Explore effective communication strategies to ensure collaboration with other healthcare professionals and continuity of care. Chapter 11. Patient Education and Counseling. Empower your patients with knowledge about their GI health. Learn how to provide education on healthy lifestyle choices, dietary modifications, and the importance of regular screenings. Develop effective counseling skills to address patient concerns and encourage proactive GI care. Congratulations on completing our comprehensive guide to assessing the gastrointestinal system. Armed with knowledge and practical skills, you are now equipped to perform a thorough GI assessment. Remember to approach each assessment with empathy, respect, and a patient-centered approach. Continually refine your skills through practice and ongoing learning to provide optimal care for your patients. Together, let's promote GI health and enhance patient outcomes.